Hello everybody. So today we'll be talking about the normal observations that are seen in newborn. So first we'll be discussing the normal vital signs and their normal range, and next we'll be discussing some normal skin and mucosa findings that are seen in newborn. A normal temperature range of a newborn is 36.5 to 37.5 degrees centigrade. The heart rate ranges from 110 to 160 per minute, and the respiratory rate is 40 to 60 per minute. Capillary refill time, that is what is measurement of the circulatory status of the body, that is checked over the bony prominences. Preferred site is the sternum, over the sternum. The capillary refill time or capillary filling time, that is less than 3 seconds. Repeating heart rate 110 to 160 per minute, respiratory rate 40 to 60 per minute, and the capillary filling time is less than 3 seconds. Coming to normal findings in the newborn skin and mucosa. Erythema toxicum, that is seen as most common skin and mucosa finding, though it's a misnomer. It is now known as erythema neonatorum. The appearance that is seen are kind of red or yellow papulopustular lesions that appears after 24 hours of birth. The erythema toxicum, on microscopy you will see lots of eosinophils. Treatment is nothing, you just have to reassure the parents. Another finding that can be seen is a pustular melanosis. This also appears within 24 hours, but here there will be hyperpigmented patches along with pustules. And on microscopy, the name suggests that pustular means more neutrophils will be there. Both the cases of erythema neonatorum and pustular melanosis requires reassurance only. Next, going to discuss some hyperestrogenic condition. Because of the maternal estrogen, the female baby may have white discharge per vagina, that is the mucus coming out from the cervix, or there may be bleeding or spotting per vagina because of the withdrawal of the maternal estrogen. Sometimes breast engorgement in female babies can be seen. All these things because of the effects of maternal estrogen. There may be some epithelial inclusion cysts or epithelial retention cysts can be seen, which appears as white color. Number one is milia. Milia is something that's in around the nose and face. Those are also known as milk spots. Number two, that is what is called white spots or a Vaughan's nodule that are seen in gums. And some nodules are also seen over the palate. Basically, the hard palate is your Ebstein's pearls. So, first one is the milk spots that is around the nose and face, and then is white spots or Bowen's nodule over the gums, and Ebstein's pearls, those are seen over the palate. These are all your inclusion cysts. Next two very important, number one, that is Mongolian spots. These are basically hyperpigmented macules, mostly seen over the back, lower back, and that is very common in Indian and Asian people. And number two is your Salmon patch. The Salmon's patch are also known as Stork's bite or nevus flavus, which are basically the bright red colored lesion seen over forehead and nape of neck. Repeating, Mongolian spots are seen on the lower back, and Salmon's patch basically seen over the forehead and nape of neck. Some other normal findings that you need to remember is small amount of subconjunctival hemorrhage while passing through the birth canal, and sometimes what happens in case of male babies there may be physiological phimosis that is seen, and in case of female babies there may be hymenal skin tags that are present. In all these conditions that till we have discussed requires only reassurance, that is only treatment required for all these normal newborn findings. So in the next audio sessions, we'll be talking about various head swellings that are seen in newborn like caput succedaneum, cephal hematoma and subgleal hemorrhage, and how to differentiate or identify them based on the clinical presentations of the baby. Thank you.